Okay, so this is the chapter on diuretics. The drugs to know for diuretics are OTL-PC, that is the osmotic drugs, thiazides, loop agents, potassium-sparing drugs, and carbonic anhydrase inhibitors. Osmotic drugs are mannitol. Thiazides are hydrochlorothiazide. Loop agents, the mnemonic over here is lots of fur on torso and bum at the Arctic. That is furosemide, torsemide, bumetanide, and ithacrinic acid. Potassium sparing drugs are a set. What is the set for these drugs? Spironolactone, eplerenone, and triamterene. Carbonic anhydrase inhibitors, acetazolamide. General monitoring of diuretics, we use BEEF. BEEF is what? Blood pressure, elimination, that is the urine output, electrolytes, and fluid status. Okay, then we go on to the first drug, that is osmotic drug, mannitol. It is used to treat a reduction in intracranial pressure. So it is used to treat high intracranial pressure and high intraocular pressure. All right, and we have to keep this drug warm at room temperature. Warm because at room temperature it will crystallize. Unintended outcome of this drug is pulmonary edema. Now we go on to our thiazides. Hydrochlorothiazide adverse effects are hypo-MNCK. This is the mnemonic. Hypo-MNCK, hypergluc, and P2. Hypo-MNCK is hypokalemia, hypomagnesemia, hyponatremia, hypochloremia. Hypergluc, we know this. And P2 is P and photosensitivity, sulfur allergy. Thiazides, we take more potassium for thiazides. It is a very cheap drug and it is a first line drug for hypertension. What are the nursing considerations? We assess the dehydration of the patient, daily weighing. We notify the provider if the creatinine clearance is less than 30 because the drug will be ineffective then. All right. Signs and symptoms of, we assess signs and symptoms of hypokalemia. There is like cramps, weakness, nausea, vomiting. So usually for diuretic drugs or drugs which act on the kidneys, when in doubt, we avoid NSAIDs and lithium accumulates. Then we have loop diuretics. Loop diuretics, we know the mnemonic for this one, and these can be used in really low creatinine clearance as well, whereas hydrochlorothiazides are ineffective if the creatinine clearance is less than 30. For hydrochlorothiazides, the adverse effect is hypergluc. For the loops, it is hyperglu. All right, it has lost the calcium. So these drugs can also be used for hyper patients in which calcium is elevated. Mechanism of action. It inhibits the sodium reabsorption in the thick ascending loop. All right. So mechanism of action is it inhibits the sodium reabsorption in the thick ascending loop, and that's why there is sodium loss. Adverse effects is hypo-MNCK and hyperglu. Loop diuretics are taken in the morning with food. This is the mnemonic again, lots of fur on torso and bum at the Arctic. The important notes over here is that it is used to treat heart failure since it is a strong drug. The ADR is hyperglu, so it can be used if the patient has hypercalcemia and photosensitivity, sulfur allergy seen with these drugs. This is loop earrings. This is a mnemonic. Loop earrings, so ototoxicity. Potassium loss is seen, so usually furosemide is given with potassium chloride. Ethacrynic acid is the loop which does not show sulfa allergy. Important point. Normal blood potassium levels is 3.6 to 5.2. Signs and symptoms of hypokalemia, leg cramps, weakness, nausea, vomiting. Signs and symptoms of hypomagnesemia. Magnesemia is muscle twitching, tremors. Alright. Now we go on to potassium sparing diuretics. That is, they increase the body's potassium. This is a set. What is the set? Spironolactone, eplerenone, and triamterene. It is used to treat HAHA. This is the mnemonic. What is HAHA? It is heart failure, ascites, hirsutism, and anti-androgen effects. That is, it is used to treat acne, PCOS, gynecomastia, impotence, and menstrual irregularities. Then the next drug, which is triamterene. Triamterene, important point, is blue urine. Blue urine might be seen with this drug. It is used to treat hypertension and it treats hypokalemia caused by other diuretics. Okay, so basically triamterene can be given with hydrochlorothiazide. Then we go on to carbonic anhydrase inhibitors. The drug over here is acetazolamide. It is used to treat AE3. A and E, mnemonic over here. All right. What is it used to treat? It is used to treat altitude illness, edema, elevated intraocular pressure, epilepsy. Adverse effects are metabolic acidosis and hypokalemia. All right. Okay, so usually for diuretics, we encourage the patient to take potassium-rich foods, except for potassium-sparing diuretics. And that's about it.